Hello. Would you like to tell us a little bit about yourself?
Yep. I'm Chris Finnegan, Advanced Case Manager or Community Matron for the Aylesbury East team, in the integrated team in Aylesbury Town. I've been a non-medical prescriber for 6 years, one of the first cohorts of people to undertake the course, and I've developed the role. It's evolving all the time.
Thank you.
Hi, can you say who you are and what you do?
I'm Diane Stiff. I'm a community matron and an independent nurse prescriber. I've been a prescriber for the last 5 years.
Will a nurse manage glycemic control or heart failure regime?
On my caseload within South Bucks, I have many patients, of which quite a few have diabetes. Through non-medical prescribing, I'm able to initiate insulin, titrate insulin, and monitoring the glycemic control so the patient's experience is within their own homes where it should be. How do you see working as a community matron enables you to work as a team to deliver the right care in nurse prescribing?
Well, if you consider the other prescribers in primary care, there's obviously doctors who've been prescribing the longest of all of us. There's dentists, there's vets, there's pharmacists, and now there's nurses, and also podiatrists. Each and every profession has got its own body of knowledge. It's got its own research articles. The courses are different, they overlap, but there's significant differences. And I believe that the real difference that a nurse prescriber can add to this body of knowledge is another pair of ears, another pair of eyes. It can have a more holistic approach, and obviously everybody as a prescriber tries to be patient-centred, but each and every profession has got a different viewpoint from where they emanate from. Hi, the big thrust in all the Department of Health documents is about self-management and enabling people with long-term conditions to self-care, to be given a self-care plan, and to be, given the information that they need to care for themselves. How do you think that fits with being a non-medical prescriber?
Within the community matron team, we've been in a very privileged position whereby we've been enabled to develop self-management plans for the people that we see. Being a non-medical prescriber as well makes this a really super place to be. You're able to discuss with the patient the medication that is most appropriate to them at the time when they need it. With the non-medical prescribing leaflets to support it, you give them help and support working towards when they need to initiate the medication, which medication to take, how much to take, who to tell, and if things are going wrong, how to get the appropriate help that they need.
Thank you.
I'd like to spend a few minutes now thinking about how you maintain that the medications that you're prescribing are appropriate for the person you're delivering it to.
Well, the most important thing about a nurse medical prescriber is that every prescription that you write has to be evidence-based. It has to have been subject to randomised control studies. It has to have been passed by licensing authority, and it has to be, specifically for a certain condition. Unlike doctors who can sometimes prescribe off licence if indicated, we as nurses cannot prescribe off licence. We have to make sure that it's maybe recommended by NICE, that it's cost effective, and that it's safe. Patient safety is paramount. So we always work to protocols, and we always are safe. In primary care and secondary care, there's lots of doctors and medically trained personnel. How do you feel that the non-medical prescriber fits in to the team?
non-medical prescribing can only work if it's a team effort, so that every member of the team knows exactly which medication is being prescribed, and more importantly, which medication is actually being taken. So it's a link between the prescriber, whether it be the GP, the non-medical prescriber community matron, the hospital. Everybody needs to talk.
Thank you.
And to wrap it up in a few words, how would you say being a nurse prescriber has enabled you to do your job, and how does it influence what you deliver to the patient?
The course itself was quite strenuous, quite a lot of pharmacology, pharmacodynamics. It taught me to consider the patient and the existing medication that they're on, checking for contraindications, any allergies, anything that would prevent me from prescribing. I forgot what the question is. What was the question?
Wrapping it up.
Yeah, wrapping up.
To sum up, for you as a nurse prescriber, how would you say this has influenced your practice, and how do you think the patient benefits?
I think one of the most resounding feelings I had when I first started to prescribe was the accountability aspect of prescribing, and it took me about 30 minutes to write that first prescription. I was checking it, had I put the dot in the right place, had I put the NHS number on, had I got the patient's date of birth, everything, how we were taught, and also making sure that it wasn't going to do any harm to the patient.
And from the patient's point of view, what impact do you think you being a prescriber has on their lives?
Well, I think it's improved access to healthcare. Most of my patients are housebound, or they're having care delivered in the most appropriate setting, i.e. in the home. And often, they find it difficult to access healthcare. Usually it's because of their own making. They might start to feel unwell on Thursday morning and think, not want to bother anybody, because they don't want to bother the doctor's too busy. So they might leave it and leave it and leave it until they're at a point where recovery is going to be very difficult. And I think that there's something special about the nurse-patient relationship. We're not perceived to be as busy as doctors, and often they'll ring us at the first sign of a problem, knowing that we will respond and help them.
Thank you.
Thank you.